During this IMS 20th annual meeting, we've presented the data about patient-reported outcome as part of the MagnetisMM-3 prospective trial. And actually, this protocol is about the use of an anti-BCMA bispecific antibody, namely Elranatamab, in relapsed refractory multiple myeloma. And these bispecific antibodies are immune therapies like, for instance, the CAR T cells that are really making a huge difference in the natural history of the disease, of the myeloma disease. However, we need to be aware that beyond the response rate, beyond the progression-free survival, beyond all of these classical outcomes, we need to pay a lot of attention to the patient-reported outcome. What are the feelings of the patient about the treatment? What's the quality of life? What's the level of fatigue? What's the level of depression? What's the level of anxiety, etc., etc.? And this is why I think this is crucial. So for instance, what we could see here, and I will not go into the outcome data, but rather into the PROs that are reported, and they are quite robust. Actually, when we compare to the baseline, there is some worsening in the beginning, in the first 2 cycles, compared to the baseline. And this is likely due to the burden of the disease, the symptoms. But then, very quickly, the patient will come back to baseline. And interestingly, around the 10th after treatment, after efficacy, when things are improving, actually there is a true improvement. And this is extremely important because we know, for instance, that the bispecific antibodies are given on a regular basis. So obviously the schedule may vary from every 2 weeks, every month, every 3 weeks, that's not, but they are given. So by having this continuous treatment, you may wonder what is the impact on the patient feeling and reported outcome and quality of life. And here, I think we're quite comfortable to consider that the PROs are rather positive in these patients. And I believe this is good news, and I'm convinced that more and more we should include the different patient-reported outcome measurements as part of a comprehensive evaluation of the activity of a given new drug.